Hello, thank you for attending our presentation today. Notable nurses in Alabama's 67 counties. We are so excited to share our presentation with you today. I'm going to share the screen so that you can meet the team. Here we are, our team for today. We have Dr. Denisha Hendricks, who is our tech person and our strategist, who will assist us in making sure that we accomplish our ultimate goal. We have Dr. Ola Fox. Dr. Ola Fox is an associate professor emerita from Spring Hill College in Mobile, Alabama. I am Constance Hendricks, a full professor emerita from Auburn University, Auburn, Alabama. We also have Dr. Valerie Thomas, who is an associate clinical professor from Auburn University, Auburn, Alabama. We have Mrs. Anita Love, who is a retiree from Montgomery County, former Alabama Board of Nursing member. We have Mrs. Vera Smith, who is a retiree from the Tuskegee VA Medical Center, now Cavis East. We have Ms. Patricia Gillette, a retiree as well from Cavis East, Tuskegee VA Medical Center. We have Dr. Elcito Bradley, who was the 20th president for Cadet Phi Nursing Sorority and resides in Los Angeles, California. We have Ms. Etta Felton, who is a retiree from the Tuscaloosa VA Medical Center. We have Ms. Patricia Ann Wilson, who is a retiree from the Birmingham VA Medical Center. We have Ms. Mary Dorsey, who is a retiree from the Montgomery VA Medical Center. And we have Ms. Gwen Lipscomb, who is a retired director of the Office of Minority, former director of the Office of Minority Health from the Alabama Department of Public Health. This is the team for Alabama Notable Nurses. There is no actual, potential, or perceived conflict of interest among the participants in this presentation, as defined by ANCC. We do not have any conflicts of interest or any ability to control or influence the content of an educational activity as prescribed. Here are the objectives for our presentation today. This presentation will describe the implementation of an effort to honor nursing and nurses during the 2021 Year of the Nurse, or should I say Years of the Nurse. The presentation will describe how the expanded statewide project will be implemented. This project supports the National American Nurses Association initiative entitled Honor a Nurse. These legendary notable nurses that we will identify, and some we have already identified, are well known in their community. However, they are not known to most of us. The selection or the nominated notable nurse that meets the criteria for inclusion will be profiled in a publication, a book, or an ebook. Each selected nominated nurse or their family will be contacted to provide a formal consent for inclusion. The presentation will introduce the project and solicit nominations for recognition of those registered nurses with 35 years in the profession. The notable nurses working in community hospitals and community healthcare agencies will be categorized by ASNA district counties. Those who worked in the Alabama Department of Public Health will be grouped using the ADPH 11 regions or areas. The notable nurses who worked in one of the 4 Alabama Veteran Administration medical centers will be grouped by hospital. A special designation will be done for those cadet nurses who were members of Chi Eta Phi Nursing Sorority Incorporated. The notable nurse selection team has begun to identify these cadre of notable nurses. However, we are seeking to recognize at least one notable nurse that we might recognize from each of the 67 counties in Alabama via your assistance with the nomination process. Again, we just want to recognize and acknowledge and put our notable nurses' names in print. Let me share with you the history of the Alabama Notable Nurses Project. This began as a course assignment while the program at Concordia College, Alabama was open. The initial class or inaugural class of 4 RN to BSN students were assigned 4 distinguished nurses in the community that were not known to them. They selected randomly a name, and part of their assignment was to visit them and interview them using a flexible, semi-structured interview script prepared by the course faculty. Again, they were interviewing a notable nurse, someone who had at least 35 years in the profession. Each of the notable nurses in that first group was also designated as an honorary class member, and they received a scroll with that designation, as you see here. Here again are those inaugural notable nurses: Mrs. Vera J. Booker, Mrs. Nan Curtis, Mrs. Julia Harris, and Mrs. Etta S. Perkins. These were the first 4 notable nurses identified. The second class at Concordia College RN to BSN program had 8 students in it. Each of the 8 students were given the latitude to identify a notable nurse with the designation or description as we have mentioned earlier. These are the notable nurses that they self-identified and interviewed and presented in class. Dr. Tracy Shannon was identified by Cynthia West. Dr. Naomi Effinger was identified by Shayna Sellers. Mrs. Ann Fisher was identified by Tammy Blackman. Miss Frances Ford by Kashayla Barlow. The late Dr. Geraldine Allen was identified by Miss Doreen Myrie, and she was able to interview her husband. Dr. Carol Ratcliffe was identified by Miss Sierra Johnson. Miss Dorothy Chapman was identified by Sharon F. Hardy, and Dr. Constance Hendricks was identified by Felicia Williams. mentioned that we would have a special section for cadet nurses. Now, for many of you, you may not be familiar with the term cadet nurse, but it was authorized by the U.S. Congress in June of 1943, signed into law by President Franklin D. Roosevelt. This act, a legislative act, contained a specific provision that prohibited discrimination based on race, color, or creed, and it was designed to help alleviate the nursing shortage that existed during World War II. The U.S. Public Health Service was the supervisory agency, and it was open to, remember now, back then, nurses were women. All women between the ages of 17 to 35 who were in good health and had graduated from an accredited high school. But they also expanded it to college women, and they could be recruited as well. Schools of nursing were eligible to participate, and they had to be approved and be connected with a hospital. So the participating schools had to then redesign or design their curricula so that it went from 36 months to 30 months, and they had to ensure that the students had clinical experiences in medicine, surgery, pediatrics, and obstetrics. The cadets came from all across the nation and from all backgrounds. The largest of the federal nurse training programs was this program. It allowed young women to serve their country in uniform while being protected against discrimination. Of the 1,300 schools of nursing in the country, 1,125 schools of nursing participated. The photo on this slide shows the cadet nurses that were convened from across the United States, and one of the cadets in the picture on the front row is a cadet from Tuskegee Institute, John A. Andrew Hospital, and you will learn more about Cadet Edna Moore shortly. Chi Eta Phi notable nurses. These were cadet nurses who were at Tuskegee Institute, graduated from Tuskegee Institute, and became members of Chi Eta Phi nursing sorority. Ms. Alice Howard and Miss Lizzie Jones are currently living in Tuskegee today. The deceased cadet nurses, Mrs. Edna Moore, Miss Hattie Yates, Miss Charlotte Butts, Miss Betty Dillard, Miss Hortense Scott, who was the first African-American in the state of Alabama to be licensed as a certified nurse anesthetist, and Miss Florence Robinson Henderson. These are the photos of those beautiful ladies, trailblazers. Yes, there are two pictures of two of the ladies, but the pictures were so beautiful, we couldn't make a decision. And so we shared them all with you. And many of you who have been active in ASNA for years might remember these wonderful smiling faces in our meetings. They were active members of ASNA. Let me introduce you to Cadet Alice Rose Howard, a graduate of Tuskegee Institute, John A. Andrew Hospital. These are documents Cadet Howard shared with us as we had the opportunity to interview her in 2017. She still had her paperwork. She had a copy of her induction and capping ceremony in 1944. Here's her name on the program. Here is Cadet Edna Jones Moore. We also interviewed Cadet Edna Moore. She had a lot of memorabilia that she pulled out and shared with us. Many of you will remember Cadet Edna Moore or Mrs. Moore at the ASNA meetings. I got her to smile, and I had to share that picture with you. This was in 2017. She has now transitioned. Here is Mrs. Moore's program, her graduation program, and you see her name. Here's a copy of the program itself, summer session in 1957, August. Here is Cadet Hattie Scott Yates. These are photos that she shared with us when we interviewed her in 2017. Mrs. Yates has transitioned as well. There was a court case brought forth by the cadet nurses petitioning to get credit for their military service, because when they signed up for the program, they had to state that should their services be needed, they were willing to become active. However, they were never called into service, and they did receive credit for their service. Dr. Elcito Bradley was the 20th president of Chi Eta Phi sorority. When the interviews in 2017 were conducted, and she shared this message with you about Chi Eta Phi nursing sorority. It is a national sorority of registered professional nurses and nursing students, organized October 16, 1932, by Aileen C. Ewell and 11 other courageous registered nurses. The first chapter was Alpha, organized at Freedman's Hospital in Washington, D.C., on the campus of Howard University, for the purpose of elevating the plane of nursing and increasing interest in the field of nursing. The sorority's motto, Service for Humanity, guides the programs that they focus on: health promotion and disease prevention, leadership development, mentoring, recruitment, retention, and scholarship. Registered nurses who hold a current licensure are eligible for membership into Chi Eta Phi sorority, now male and female, by invitation, as a graduate member, an undergraduate member, or an honorary member. We want to thank Dr. Bradley for sharing this statement with us. The headquarters is located in Washington, D.C. Mrs. Pat Gillette has served as the president of the Epsilon chapter, which is the Chi Eta Phi chapter in Tuskegee, Alabama. It is the fourth chapter that was chartered in May of 1939 at the nurses' home residence of the VA hospital in Tuskegee, Alabama. For the past 82 years, it has attributed to its individual commitments of service through its membership growth. Mrs. Gillette has served as a chapter historian and provided the statement you now see. Jewel Crawford was the first president of Epsilon chapter. She also served as a national secretary. Anita K. Bass was the third national president. All of these wonderful ladies came out of Epsilon chapter. Dr. Lillian Holland Harvey, who is accredited with launching the first BSN program in the state of Alabama at Tuskegee Institute, was a member. She was also the 29th recipient of the Mary Mahoney Nursing Award given by the American Nurses Association. ASNA annually awards the Lillian Holland Harvey Award at its annual convention. Dr. Harvey provided nursing care, and she and her students for the injured civil rights marchers during the march from Selma to Montgomery. Dean Harvey was honored as the first Dean Emeritus from Tuskegee University. Dr. Mary Starks Harper is an honorary member of Chi Eta Phi and is known for her pioneering mental health research and emphasis in health disparities. And there is a building on the campus of the Tuscaloosa VA named in her honor. Warrena Turpin was the 13th regional director, and her commitment to infantile paralysis unit at the John A. Andrew Memorial Hospital in Tuskegee is accredited to Ms. Turpin. Epsilon chapter has launched many nursing leaders. We thank Epsilon chapter for its inclusion with the statement in our presentation today. And now let's get to the subsets of recognition for our notable nurses in Alabama. As we have said earlier, we will have three additional designations. The first, of course, will be the ASNA districts, and then the Veterans Administration hospitals in Alabama, the Alabama Department of Public Health as well. Now, our team members will introduce to you those district numbers. We are not prepared to share names just yet. You're going to have to wait on our book, but we will share with you the beginning of the project. And now we will focus on the 5 membership districts in the Alabama State Nurses Association. For District 1, we need your help desperately. We need you to help us identify those notable nurses out of District 1. We know they are there. So please make a note and send us the names of District 1's notable nurses who have 35 years plus of nursing, a nursing career, in the nursing career. District 2.
This is Etta Felton. For District 2 in Dallas County, we have 23. Greene County, we have 1. Perry County, we have 1. In Tuscaloosa County, we have 17.
Wonderful, but there are some more counties in District 2. We need your help to help us know those notable nurses out of District 2. District 3. In District 3, we have 1 identified from Clay County, 9 from Etowah, 26 from Jefferson County, but there are many more notable nurses out of District 3. We need your help to identify those nurses. They deserve to be recognized. District 4.
This is Dr. Ola Fox, and as you can see, we need your help for District 4. We have 1 from Baldwin County, and we have 8 identified notable nurses from Mobile County. But as you can see, we desperately need you to send us names for the other county. Let us know who your notable nurses are so they can be recognized.
District 5. District 5, we have Chambers County. We've identified 4 so far. Lee County, 15. Ms. Smith,
Okay. For Macon County, we have 16 identified.
Mrs. Love, we have 28 with the help of Mrs. Anita Love out of Montgomery County and 10 out of Tallapoosa County. But there are many more counties in District 5. Please help us recognize the notable nurses out of District 5. Now, the Alabama Department of Public Health, a very special group of nurses, and we want to give them a special shout out.
This is Gwen Lipscomb. We're proud to say that we have one representative out of Morgan County and one out of Coleman, but as you can see, we need many more. Out of District Lamar, I'm trying to read it, but out of Lamar County, we have no one right now. Jefferson County, I'm sorry, we have 3 out of Jefferson County, 4. No, I'm reading that wrong. Out of Jefferson County, I'm sorry, we have 3, but we have 9 out of the other counties in Area 3, but we have 3 in Shelby. So we're working on the rest of the counties in Area 3, 4, and 5.
And we have 1 in Tuscaloosa County.
I'm sorry. In Area 6, we have none.
We need your help.
Yes, we need your help. In Area 7, we have 4 out of Dallas County. We have 1 out of Choctaw County, and we need help with Lowndes and Hale. Out of District 9, we have 2 out of Monroe County and 1 out of Escambia County. We're working on Washington and Baldwin County. Out of District 8, we have 1 out of Chilton County, 3 out of Montgomery, and 2 for Macon County. Out of District 10, we have a big vacancy, so we need your help with most of those counties out of 10 and 11.
Thank you. And now, the VA, U.S. Department of Veterans Affairs in Alabama. Ms. Smith.
Okay, this is Vera Smith for VA Tuskegee, and we're very proud that we have so far 38 notable nurses already identified, but there are others we expect to receive other nominations also. So a total of 38.
Ms. Dorsey.
This is Mary Dorsey from Cadet West Campus. We have 28 nominees, and we are looking for more.
In Birmingham, we have been able, with Ms. Wilson's assistance, to identify 48 notable nurses who were employed in the Birmingham VA hospital.
This is Etta Felton, Tuscaloosa VA Medical Center. We have 25, and we will be adding others.
So how can you help? We need you to help us with nominations. We need you to help us spread the word, and we will be needing additional donations. So again, let's recap what we need your help with. Nominations. We are looking for Alabama notable nurses. They are the registered nurses in your community who have demonstrated extraordinary contributions to the nursing profession by making sure that their county, their community health was improved beyond their work environment. They must have been a nurse at least 35 years. Now, they could have begun nursing as an LPN as long as their years as a licensed nurse adds up to 35. They might be nominated. Nominations may be made for a living or a deceased nurse. You may nominate yourself. That's quite all right. If the nurse you nominate is deceased, we must have a release to include that nurse's photo, if possible, and information about that nurse in our publication. And we need you to tell us why you or they are a notable nurse and should be included. Here is the notable nurse nomination form. It is a fillable form. You have the link, and we will provide that to all of those who are interested. It will be on our Facebook. Here is the email. You can email us, alabamanotablenurse@gmail. We can resend the link to you. All you need to do is fill it out. Everything is uploadable, including the photo. Again, this is our Facebook page for the Alabama Notable Nurse. The link to submit will be on our Facebook page. This is our official logo. Every nurse who is included in this project will be honored with a notable nurse lapel pin, and maybe even other gifts, depending on the finances. Here's a notable nurse release form. And this is the sample of what we would require when you submit the name to give us permission to include your notable nurse in the project. So we need you to spread the word about our notable nurse project. There are some of us who are 35 years or more in nursing. You would be a bronze notable nurse. For those of you who have 40 plus years, we consider you a silver notable nurse. There are some of you out there with 50 years. You are considered our gold notable nurse. There are some out there who have put in 60 years in our wonderful profession. We consider a diamond notable nurse. And there are some of us out there who have 70 years plus. You are our platinum notable nurse. Again, a reminder, there are additional subsets beyond the ASNA districts. If the nurse worked at the VA, we want you to designate them to go in that category. If they worked with the Alabama Department of Public Health Nursing, they should go there. If they were a Chi Eta Phi cadet nurse, we would include them in that subset. Who knows? You may help us identify additional subgroups as you begin to share the notable nurses from your community. We would send each nominee a letter to inform them that they have been nominated. And if you did not send the information, we would ask them to give us the permission to include them in the book. So help us not lose the wonderful contributions of those whose shoulders we stand upon today. Each would receive a designation similar to the one I've crafted here. And I placed Miss Perkins' name because she already knows that she was an inaugural notable nurse. And so this is a sample of what the others would receive as a designation of being a notable nurse. So the future of our project, with your help, will yield a publication, Alabama Notable Nurses Book. It will provide the recipients or their families with a notable gift of the contributions of their loved ones. We expect to annually add additional nurses as they meet the inclusion criteria. And yes, we can't launch any project without a long-term goal of ultimately providing nursing scholarships. We'll get there. It's just our long-term goal. So remember, Alabama's notable nurses are real nurses, as defined by Garrett in 1978. Garrett described real nurses. Alabama notable nurses are those who engage in research, they deliver babies, they teach health, they do psychotherapy, and administer anesthesia. They hang out a shingle and diagnose patients and clients. Real nurses work not only in the hospital, but in the jails, in homes, in clinics, in colleges, schools, industry, and in the most rural as well as urban areas. For real nurses, Alabama notable nurses use their brains as well as their hands and feet. We have listed for you some wonderful references that if you choose to use them, you can enhance your knowledge of nursing history. Here's our contact information. We welcome any inquiries about our project, but we most especially welcome nominations of the notable nurses out of your community. When you think about growing up in Alabama in your community, who was the nurse that comes to mind? She or he is the notable nurse we are looking for. We will pause here for you to add your questions. You may send them via email, or you can reach out to us via Facebook. We thank you for attending our program today.